one of the benefits is that it can, promotes this overall repair capability for the brain because it's increased brain-derived neurotrophic factor. It, promotes regeneration of the neurons, actually changes your brain waves. So I'm astounded by what ketamine can do because I could be doing psychotherapy with the same person for years and giving them medications, and I couldn't put a dent on their PTSD symptoms because that wiring is set in. It's almost like it's etched in their brain. If ketamine is able to reverse that, sometimes within 1 session, 2 sessions, this is revolutionary. It's been FDA approved in treatment-resistant depression since 2018. And it's also used in various other conditions, off-label use, including anxiety, bipolar depression, PTSD, addiction, chronic pain or migraines. This medication, one of the benefits is that it can, promotes this overall repair capability for the brain because it's increased brain-derived neurotrophic factor secretion. So it helps to repair the neurogenesis. So this is what's, fairly revolutionary comparing to what we're looking at traditional antidepressants. And it, promotes regeneration of the neurons, dendritic spine formation, and has anti-inflammatory actions. So it's very interesting that it has wide range of uses. It actually changes your brain waves. When they compared people under ketamine to people who are long-term meditators, like the Tibetan high monks that have been meditating for 30 years in their lives, and they look at their brain waves, these high monks have high gamma wave activity. And that's what's happening under ketamine as well. It's gamma waves. I think we still are not understanding enough of exactly what's going on there. So I think receptors is one aspect, but the brain waves and what's happening in that state is a whole other story. We still don't understand why meditation can promote such dramatic benefit in a person's wellness and healing. So what's going on there? Why are these brain states causing, leading to that kind of healing? So by the same token, if ketamine can promote something similar, what's going on there? I think we don't know either. So there are a lot of things we don't know. So when we're looking at this medication, it's very, very safe. It's non-addictive in clinical settings. There are people abusing it, of course, and that's one of the first things that people ask, oh, is this the one that, isn't that a street drug or isn't a horse tranquilizer? Yes, there are a lot of people who are abusing it, who are snorting it, which is a whole different experience compared to using it in a clinical setting and using the IV infusion. And yes, they do use that to tranquilize animals, wild animals, or pediatric, little animals, little patients, and it's extraordinarily safe. So I actually utilize that to help some of the autistic patients I see, when I need to do procedures. For people with major depression, which is a devastating condition, 30% of them actually don't get any healing from the traditional antidepressants. Whereas if you start using ketamine, 50 to 70% of these treatment-resistant patients actually are going to have a response after even just a single 40-minute infusion. So that's pretty drastic. And the antidepressant effect can manifest within 2 hours, and 35% of the patients can maintain response for 7 days. And there's more than 50% improvement in symptoms, and there can be instant reversal of the suicidal thoughts, which is really powerful. We don't have anything that can drastically reduce suicidal thoughts. And so the fact that they act so rapidly really put pause on what's going on. If we used to think that it's going to take time for the antidepressants to work, to promote changes. But apparently, there's more to that story. So the fact that there's rapid changes in the synaptic function and the plasticity in the synapses, that makes you wonder, about the whole model of depression treatment. So we may be missing the boat. Why I'm interested in ketamine, So, I do have, the background of being trained in psychiatry. So that's my first specialty. I worked for 11 years as a psychiatrist, worked with a lot of veterans, worked in the county emergency room, worked in mental health clinics. So I've seen a lot of, difficult cases, and definitely PTSD, one of the most difficult, most challenging conditions. And, so I'm astounded by what ketamine can do, because I could be doing psychotherapy with the same person for years and giving them medications, and I couldn't put a dent on their PTSD symptoms, because that wiring is set in. It's almost like it's etched in their brain. No matter what we do, no matter what we say, no matter what medications I give them, that hypervigilance, that stimulus response, this jacked up response is always there. So if ketamine is able to reverse that, sometimes within 1 session, 2 sessions, this is revolutionary, whether or not it's addiction or for mental health treatments. You're not addressing the person from the ground up. You're only trying to target certain receptors in the brain, and you're missing the boat of what's going on in the whole body. So that it's doing patients injustice. So anti-aging medicine, when you can reverse aging, reverse the decline that's associated with aging and all the inflammation, then you can actually get to the root causes of what's causing mental conditions. So inflammation actually is a huge part of what's triggering mental health issues. So about personal challenges, we all have personal challenges. I think I grew up in a pretty healthy household, but with an overcritical mother. But we've all had challenges. But some people are genetically more prone to some mood issues. So since I was a teenager, I realized, okay, I have a periodic, little bit of, mild depression and a little bit of anxiety. And from the anxiety, I realized, okay, if I eat some food, I'm going to feel a little better. So that led to this cascade of, eating, basically dysregulated eating. So sometimes I'm fine, and sometimes with hormone, in certain time of month, then it gets a lot worse. So these are some of my challenges, even during medical school, so it kind of comes and goes. I think it has to do with, my own health. So when I was looking at ketamine, I was like, okay, if it can have this kind of drastic benefit, if it can make my brain repair better, and if I can be more free, or even just be free of the carb cravings, at night, if I'm feeling a little anxious, if I eat some carbs, I feel better. But I don't want to do that, because then I have to, next day I have to starve myself to try to counteract the damage I did. So that was a vicious cycle. So I thought, well, ketamine helped with mood, helped with addiction. I think that, there's some kind of dysregulation with eating disorder. Maybe it can help me. So that was part of my interest, to look into ketamine. And what I didn't realize was it was such a, mind-blowing experience. Because usually I'm not very sensitive to medications and substances. I just figured I'm just going to sit there and just be maybe a little bit more relaxed. I didn't think much, it's going to be, it's going to be that exciting. And then within 30 seconds, I was taken to a whole different realm. And I've never been able to break through this solid world right in front of me. And so I didn't know if there's anything beyond. So the fact that I was seeing something that's so complex, so profound, so drastic right in front of my eyes, and they keep changing and they keep evolving, the complexity of the imageries I was seeing. And of course, the feeling it's pretty amazing. I've never been that free in my life. But the imagery were so complex. That's when I realized, okay, this is not a hallucination. Hallucination is, I think, it's almost disrespectful to, as a way of describing the experience. Hallucination, as a psychiatrist and board certified in psychiatry and neurology, hallucination is when you have this dysfunctional ability to perceive the environment. So you're faultily interpreting the environment. You're hallucinating. It's some kind of distortion. That is what's called entropy. So you're losing a complexity of your world, because that's a downward energy shift, because you're losing quality, right? It's a malfunction. But what I'm seeing is gaining complexity. So if you're gaining complexity, that means there's energy infused. Otherwise, you wouldn't have gained complexity. So that's something that's really drastic to me. That what I believe is that I'm seeing something that is not a distortion from my brain, but is a perception of another reality or another type of existence or existential phenomenon. So, I used to say that I'm not afraid of death. I've never, since I was 7, when I got over the fear, I'm not afraid of death. But after what I've experienced, what I have, what I've seen with my own eyes, I realized that I'm actually looking forward to death, because it's incredible. It's freeing. It's beautiful. It's powerful. So it's going to be a ride. It's going to be, a blast by the time it comes. So it gives you a whole other perspective. And I think that one is powerful, because I think as a physician, it's almost a taboo that we talk about spirituality. And that's an abomination, because that's part of human existence. And as physicians, we don't want to talk about, almost like you don't want to touch, spiritual. No, that's not part of medicine. No, new medicine is going to include spirituality, because we need to understand why that is part of this existence. It's probably as physical as everything we're observing, but most people cannot perceive it. I think as physicians, we need to be more open-minded. And the fact that you are getting a new perspective is changing the way that I'm living this life. Because instead of thinking, this is the only life I have, I realize that I'm actually eternal, but this is one time I'm going to have. So this is joy, living as joy. This is one opportunity to live as joy. So I want to kind of impress upon you that this is your one opportunity to live as you, but you are going to go on. But this is a precious opportunity. So, the fact that I was deep into stem cell therapy, got me to start a clinical trial on stem cell therapy in traumatic brain injury, to see how effective it can be. And that requires SPECT brain imaging. So I did that one on myself, just to see what process patients go through. And then I had a surprise finding, which is this is my brain card. So it just shows you what different areas of the brain, how they're affected. So this, you can't really see much, but here's the reading. First thing you see is that this is an abnormal brain scan. And it showed all these areas of hypoperfusions, right? Low blood perfusion. So including various cortical areas, so that's outer shell of your brain. Basically, every hemisphere or every region is defect. There's defect. Frontal, temporal, parietal, occipital, cerebellar, and then a subcortical region. There are also areas of hypoperfusion. And then amygdala, there's hyperperfusion, so too much, which means it's too activated. And so the conclusion from the scan reading is that this is a occult traumatic brain injury. So this is a big surprise to me, because I have no recollection that I was ever hit on my head or, fell in any way. Maybe there's a little bit of fall, but nothing severe. So I think a lot of us carry occult traumatic brain injury, having no idea. So finding this out, I was on a mission to heal myself. So how did I attempt to heal my brain? First of all, I was excited about ketamine, and I know it has neuroregenerative properties. And then I also want to combine different modalities. And then I want to repeat brain scan in 2 months, and, which is never done, because the location that did the SPECT scan actually only do repeat scan, on average about, in 6 months, but I wanted to do it in 2 months. So So I just wanted to show you a little bit, quickly the neuroregenerative properties of ketamine. First of all, induces a sharp increase in BDNF, and that has been shown to be necessary for ketamine's antidepressant effect. And then also, ketamine can cause synaptic increase of BDNF, and that eventually led to increased synaptic efficiency. And ketamine also can activate mTOR pathway, which is very famous now for longevity, and that leads to a cascade event that can increase dendritic spine and synaptic strength in the prefrontal cortex. So here's another article talking about neuroprotective effect of ketamine in traumatic brain injury, in subarachnoid hemorrhage, in stroke, and other neurological diseases, because it inhibits these neuronal discharge across all these injury modalities. And a single dose of ketamine can mitigate post-operative cognitive dysfunction, so after operation, and also can prevent stress-induced cognitive inflexibility. And it can also provide neuroprotective function by relieving pain and inhibiting inflammation. And of course, inflammation is the basis of most diseases. And some other example of neuroregenerative capabilities, including increasing hippocampal cell proliferation and by then improving behavioral function after injury. And it can induce neural stem cell proliferation after short exposure. And it can be a novel mechanism for its antidepressant effect, which is by activating IGF-2 receptors, and that can promote neurogenesis and eventually leading to proliferation of neuronal progenitor cells. So these are just some of the basics. And so what I did was that I used various modalities because I believe in combining different treatments, including energy therapy, including heightened blood perfusion, and how I can even amplify the benefits of ketamine. So red light, helmet, full body light, and PEMF, inversion table, and infrared sauna. So I talked about that in panel discussion. So this is my clinic. This is the room where we have a PEMF mat and we have a full body light treatment, which gives you a completely different experience. And this is the helmet that we can use to help with brain repair. And this is the infrared sauna, which the infrared ray is actually very healing. And of course, infrared sauna helps you with detoxification. So we also do that. This is through an intramuscular injection, and patient has an incredible experience. They're completely different from the other type of light therapy. And then inversion table, that's a whole other story. But so I incorporated various modalities. And then 2 months later, here's the result. Cortical structures, we talked about various areas of hypoperfusion. So you could see, so this is exactly 2 months later, that, in frontal lobe, in the, the 5 areas of hypoperfusion drastically improved or not noticeable. And the cortical area also resolved, the hypoperfusion was resolved. And the increase, the hyperperfusion in amygdala also is not, they couldn't really see it on the scan. So I do combine these modalities in the clinic because I do believe that we are energy beings, and energy and light therapy is a powerful way to energize your cells, and it has much more profound effect than we previously knew. So by combining that with ketamine treatment, I do think that it accelerated the healing of my brain. And so I just want to share that with you. This is the first time I ever shared that in public. And thank you for listening to my story.